Mr. Russell, your plan for a single-payer national health program where government panels set the remuneration for services rendered would also end the possibility of market forces and competition making medical care more cost-effective. What is wrong with the Massachusetts plan, which makes health insurance available to all through a premium support model, but also keeping competition involved?
The Massachusetts model forces people to buy health insurance and puts them in a position whereby their choices are somewhat limited. What I want to do, and what you were characterizing single-payer health care about, single-payer health care is present right now. Medicare, Medicaid, the VA, those are all single-payer health care models. And the bottom line is, I've worked with lots of physicians. What we have to do is get the insurance industry out of the business of financing healthcare. And I know that's troublesome for my opponent, given that insurance is her largest contributor group, and she is certainly beholden to insurance. But the fact of the matter is, we spend more than any other country in the world per capita on an annual basis, more than $5,000, to provide less. Our healthcare statistics, as I indicated in my entry speech, demonstrate just how poor some of our statistics are. We need to put the money into the bedside, not into middlemen, and the insurance industry needs to exit, and that's why I support H.R. 676, a bill that provides for a national single-payer healthcare system that over a course of 15 years would remove would cause the insurance industry to get out of the business of financing healthcare. There's also another competing plan that does the same thing using a slightly different mechanism. I don't agree with the Massachusetts model, and fundamentally because it continues with the dinosaur, which is the private insurance model. Need to get them out of here. And it's not socialized medicine, which I may be characterized as once she gets up and gives her terms there, but it's going to be socialized medicine is in fact everyone being an employee of the government, and that's not what we're talking about. That defines socialized medicine. So I stand firm, as do the doctors that I work with. They're practically uniform in their support for what I'm talking about. So we need to get people in there, change the legislature, and that would include putting some people like myself in the Congress to vote for this sort of thing. Thank you.
Thank you, Mr. Russell. Folks, we've got an hour. The more you cheer, the more it takes away from the hour, the fewer questions we get asked, and I know that we love both of these folks, but we want to get as many questions in as possible, right? Thank you very much. Let's hold our applause for the end of the show. I mean the forum. Congresswoman Brown-Waite, 1 minute.
It's amazing the things that the incumbent gets accused of. He's apparently taken up mind reading. The American Medical Association, i.e. the doctors that you go to every single day, they support me because they know that I have continued to fight against the cuts that were made back before I ever got there in the balanced budget proposal that was there. They get scheduled cuts. That's wrong. Again, your doctor, your neighborhood doctor supports me. I believe we need to have more rural health care clinics, and we also need to have more funding going to county health departments. That's really where people who are uninsured go for very high quality health care. Federally qualified rural health clinics are a great resource in any community. We've increased the funding. We have sent them some construction money, and I guess my time is up. Thank you.
Mr. Russell, 30 seconds.
The AMA supports my opponent because she represents the establishment. The AMA is the establishment. That's all that's about. And my plan would make every patient a paying patient. That's what needs to happen. Uninsured patients are growing day by day, and I know some doctors won't take uninsured patients. I know, because I work for a living doing this sort of thing. So the bottom line is we have to go to single-payer model, put the money into the doctor's hands, people like myself, nurse practitioners, who provide the care to you. Thank you.
Congresswoman, 30 seconds.
The single-payer model is the model that's used in Canada. Ask most Canadians how long they have to wait for any kind of service. It's not a model that most doctors in our country embrace, and it's not one that overall patients would want to be under.